This Family Life News podcast is made possible by the support of listeners like you.
Welcome back to another edition of Hometown Heroes on Family Life. I'm Mark Webster, and this week's guest is Shannon Eaton, a Pennsylvania-based registered nurse and, for nearly 2 decades, a missionary in Latin America, who now counsels other missionaries on coping with and avoiding burnout. She began as a pastor's kid, moving around the Keystone State.
We moved to Kentucky when I was 2 for my dad to go to Asbury Theological Seminary. So we were there for 3 years and then moved back to Pennsylvania when I was around 5. And that's when he started then with churches. And we moved 3 times, I believe. And so the longest I have lived at one place in my childhood was been 6 years. So I went to a lot of different schools.
That must have been tough.
Yeah, it was, because it was rural too. And so everybody grew up with everybody for generations and from a young age. And so it was hard to fit in those barriers of the kids there in the various towns that we lived in.
Through all of that and being that pastor's kid, you did wind up with a heart for serving others.
Yes. My heart started in serving others was actually nursing. I knew that I wanted to be a nurse since a young age. And that's what I studied professionally and clinically did that until 2016.
And between then and your current spot, you look like you accumulated a lot of passport stamps, doing
Yes.
a lot of work down. Tell me about the Latin American experience.
Never thought I would be a missionary, but after walking through the loss of the death of my mom and 3 hard years is when God ended up putting on my heart to go into full-time ministry. And so I ended up serving in Peru, Honduras, and the Dominican Republic for a total of 14 years together, serving under 2 different mission organizations. And I mostly served the at-risk population of kids in Peru, serving at a residential kids' home, being the nurse there as well as the home director. Ended up going through burnout after that and then came back to Honduras and was the brigade nurse, which I was in charge of all the medical aspects of all the different brigades that we did and partnering with the churches and doing health education for the women of the churches. And then it was in a time where the Lord just really put that seed of member care or missionary and pastoral care in my heart. And that ministry that I was working with at the time was not interested in doing that. And so I left them and went back to my other organization that I served with in Peru. And they had me go to the DR because that's where the largest ministry of that organization was, with the most missionaries, and piloting their member care program and finding a third-party member care agency to partner with us. So we also had outside agency as well as developing our member care inside the agency.
Tell me a little bit more about that burnout experience. That's not an uncommon problem for people in the mission field.
Yeah, a lot of it ended up starting prior to me becoming the home director, of just not realizing or having good boundaries and not using some of the tools that the Lord had taught me during cross-cultural training. And not being able to, because I'm also a people pleaser, and so hard to say no. And so I didn't, and ended up then getting into the director's role. There was a lot due to needing the director to be let go of. And so they put me in the position. And I also had a lot of other staff members that I had to let go of during the process. And there was a lot of financial stuff that the staff and the kids were just not very happy with how I was changing things, even though it was for the betterment of the children. Yeah, it wasn't until I came back, I had a conversation with my dad, and he's like, Shannon, I think maybe it's time for you to come back to the States, as I had already overstayed my second term because of filling in for the directors. They asked me to stay longer until they could fill the position. And so I ended up leaving without them filling that position and didn't realize I was burned out. I knew I was exhausted. I knew I wasn't making the best decisions for me personally. And it wasn't until I went through my own debrief that that I realized that I, was highly stressed and burned out. And they recommended me to have counseling. So it took about 6 months before I became who I felt normally as Shannon. And part of that was also extrapolating my role of what I was doing for the Lord, which became more my identity versus my identity in just being his beloved daughter. And so, yeah, and just through counseling, that really helped to extrapolate that more and just giving me tools for putting up healthy boundaries, and also the need for having a care team to be ministering specifically to me and who I had to be vulnerable with and sharing the hard things and communicating that has been a big game changer for me as I continued on in doing ministry. And even till today, I still have a team that minister to me specifically.
No doubt a very painful experience as you went through that burnout and all the other heartache that can come along with extended ministry and mission work. But that's now, I guess, paying some dividends for you and for others that you're now helping in the field.
Yes, because it was in that time that the seed of member care was planted. And I really truly feel that my time in Honduras, reflecting back, it was a ground for the Lord to test me. Now that I've given you these skills and tools, are you going to use it? Are you going to go and do your own thing? Because I almost had to leave the field shortly after I got there because they were going to put me back into burnout if I wasn't willing to step up and say, this is not healthy, and being willing to leave if that was necessary. And thankfully it wasn't.
That's Shannon Eaton, a Pennsylvania-based registered nurse and experienced missionary to Latin America, who now counsels other missionaries on coping with and avoiding burnout. Please join us again next time as we search for your home, your town, your hero. It's Hometown Heroes on Family Life.
Thank you for listening to this Family Life News podcast. If you've been encouraged by what you've heard, please share it with others and click the subscribe button to automatically receive future episodes. Family Life is a listener-supported ministry. Podcasts like this are made possible by your financial partnership. Find out more at familylife.org.